If you're an athlete, a serious shoulder injury, man, it can feel like your career is over in a flash. You get that diagnosis, and the first thing that goes through your mind is always, am I going to need surgery? Well, today, we're going to dig into one of the most common shoulder injuries in sports and see what the evidence really says about the road to recovery.
So picture this. You've been grinding, you're at the top of your game, and then it happens. You're in the doctor's office, they're looking at your MRI, and they hit you with it. You have a slap tear. Your mind just leaps straight to the operating table, right? To months of rehab and just all this uncertainty about ever getting back to your sport. But here's the question. Is that jump to surgery the only way forward? Let's get into it.
Okay, first things first, let's make sure we're all talking about the same thing here. A slap tear. That stands for superior labrum anterior to posterior, is an injury to the labrum. The easiest way to think of the labrum is like a rubbery O-ring, this cartilage that helps keep the ball of your shoulder joint snug in its socket. The slap part, that specifically means the tear happened right where your biceps tendon latches onto that cartilage. It's a super common injury, especially for any athlete who's throwing or reaching overhead a lot.
And so, this diagnosis puts you at a huge crossroads. It's a major decision point for your entire athletic career. Do you go for surgery? I mean, it feels definitive, but it's got its own risks, and the rehab it's a grind. Or do you try the nonsurgical route, which might feel a little less certain? To figure out what the best call might be, we have to look at the evidence.
And to get our answers, we're diving into this killer 2022 systematic review. It was published in the Journal of Shoulder and Elbow Surgery. Now, a systematic review is awesome because it's not just one study, it's like the Super Bowl of research. It pulls together and analyzes all the high-quality studies on a topic. So it gives us this huge bird's-eye view of how athletes actually do when they try non-surgical treatment for slap tears.
So, if you don't go under the knife, what's the alternative? Well, we're talking about the rehab option. And let's be really clear here. This isn't just, kicking back and hoping it gets better. No way. This is a very structured, very active process designed to completely rebuild the shoulder's function from the inside out.
The studies they looked at all had this multi-phase approach. Step 1 is just calming everything down. You got to get that inflammation under control and fix any wonky movement patterns that might be causing the problem in the first place. Then you start building. You strengthen all those little supporting muscles around the shoulder blade and the rotator cuff. After that, it's about fine-tuning, retraining that brain-muscle connection so you have pinpoint control. And then, finally, and this part is so important, the focus widens to your entire body. Because look, for an athlete, power never comes from just the arm. It starts from the ground up. Your legs, your hips, your core, it's all connected.
Okay, so that's the game plan. It sounds good on paper, right? But does it actually work? Let's get to the good stuff. Let's see what the numbers say about getting you back in the game.
So, when the researchers pooled all 244 athletes from all the different studies, they found that about 54% were able to get back to their sport after trying the non-surgical approach. Now, I know what you're thinking. You see that number and you go, 54%. That's basically a coin flip. But that number, it doesn't even begin to tell the real story. In fact, if we stop there, we're missing the most important part. Because the researchers, they dug a little deeper. And get this. When they looked only at the group of athletes who actually stuck with it, the ones who completed their entire rehab program from start to finish, the return-to-play rate shot up to 78%. That is a huge leap. It completely changes the conversation. And just look at this. It lays it out perfectly. On the left, you got that overall rate, 54%. That includes everybody, the quitters and the finishers. But on the right, you have the success rate for just the people who saw it all the way through. That gap between 54 and 78% is massive. We're not talking about a coin flip anymore. We're talking about a really good chance of success.
So this begs the obvious question, right? What separates these two groups? What's the secret sauce? Why did some athletes stick with it and succeed, while others bailed and ended up having surgery anyway?
The data gives us this really incredible clue. The athletes who gave up on rehab and opted for surgery, they went to an average of just 8 physical therapy sessions. Just 8. Now compare that to the group that made it back without surgery. They went to an average of 20 sessions. So the successful group put in more than double the time, double the work. That's not a small difference. Now look, to be fair, it isn't only about commitment. The review did find that some groups had a tougher road. Think about older athletes or guys in really demanding overhead sports like baseball pitchers. A sudden traumatic injury was also harder to come back from than a nagging gradual one. And if you had another injury at the same time, like a torn rotator cuff, yeah, that made things tougher too. So these are all real risk factors to keep in mind.
So, after sifting through all this data, what's the final verdict? What should you, as an athlete with a slap tear, really take away from all this?
You know what? Let's just go straight to the researchers themselves. Here's what they wrote, and I quote, "Overall, non-operative treatment of SLAP tears in athletes can be successful, especially in the subset of patients who are able to complete their rehabilitation program." That word, especially, is doing all the heavy lifting in that sentence. It's the whole key.
So the bottom line is this. For most athletes, surgery does not have to be the automatic knee-jerk first step. The evidence is pretty clear that a well-designed, comprehensive rehab program is an absolutely viable first-line approach. It strongly supports giving it a real, committed shot first.
And that leaves us with this one last thought to chew on. We spend so much time obsessing over the right treatment. Is it surgery? Is it rehab? Is it some new injection? But what if this data is telling us something a little different? What if the key to getting back on the field isn't just the treatment you choose, but the commitment you're willing to bring to it? That's a powerful question for any athlete staring down that long road back.